Well, a warm welcome to today's talk. It's Monday the 22nd of November. Now, I hadn't really planned on doing this, but I got such a lot of response from yesterday's video and such a lot of questions. And we're looking at vaccination and pregnancy. Now, we looked at these information from the Centers for Disease Control yesterday, indicating that there's an increased risk of stillbirth with COVID-19 infection when the mothers were admitted to hospital, and that risk was increased if it was the Delta variant. So in the Delta variant time, there was more stillbirths recorded. Now, what a lot of you picked up on, and this is why it's so good to have all you people watching as kind of peer reviewers, was that vaccine status wasn't discussed in this paper. So what was the vaccination status? And a lot of you expressed concern that the vaccines were having adverse effects on fetal outcome, on the risk of stillbirth, and indeed on the mothers. Now, let's just see what this paper actually says. So I've just highlighted a bit here. It gives various reasons why there might be issues with some of the data. And this is normal when we do papers. You know, they say, well, bear in mind this, bear in mind the other. So the iterated 5 points, and then this was the sixth point. So this was the last point. And almost as a throwaway for the very last point, they said it was not possible to assess vaccination status in this analysis. Whoops, I think this could be quite a big factor. So quite an omission there from the Centers for Disease Control. And you can look through this whole paper. And really, this bit is tucked in way down here. It's way down at the bottom. Where is it? It's way down there. There we go, sixth. So it's the sixth point. So it's almost as if they didn't want to draw attention to it. I'm not saying that's the case, but it's almost like that. But then they said, however, because COVID-19 vaccines are highly effective, well, okay, that's an assumption that's not really borne out by the data in this paper, but we will be examining that. And COVID-19 vaccination coverage among pregnant women was approximately 30% as of July 2021. Most women with COVID-19 at delivery were likely unvaccinated. So an assumption on an assumption there, not particularly good science. And this gave a lot of you pause for concern. And I want to look at that in this video. And it's not the sort of thing you can do quickly. So we'll go through it though. There are quite a few useful papers to look at. We'll look at a bit of background information first, then we'll go for this one from the what was that one from? That's from the Journal of the American Medical Association. But anyway, first of all, I want to give you a bit of background. So this is etiology, the cause, that which causes. Now in the UK we spell etiology with an E, with an A. But as well, but in the States it's just an E. Spontaneous abortion. So this is the loss of the fetus spontaneously without being induced. And I was always taught that a spontaneous abortion is less than 20 weeks gestation. So if it's less than 20 weeks gestation, we would call that abortion. If it's more than 20 weeks gestation, we would call that miscarriage. At least that's how I understand that. Now, first of all, this can be sporadic, and this is so important to know about because we don't want to lose our unborn children. Absolutely, what could be more important? So various viruses we know can cause abortion. So cytomegalovirus can, herpesvirus can, parvovirus can, and rubella virus can. So the idea that a viral infection or some viral infections can cause loss of the fetus, can cause this spontaneous abortion before 20 weeks is not unheard of. So if a new viral infection came along that could do that, that wouldn't be that necessarily surprising. So live vaccines, which contain live or attenuated organisms, normally we wouldn't give that in pregnancy. Live vaccines not given in pregnancy. But non-live vaccines have previously been shown to be safe and effective in pregnancy, according to this site here that I'm referring to. In fact, that is a quote from that's a quote from somewhere else. I can't remember now, but that's a quote from one of the papers, I think. In fact, that might be a quote from the Royal College of Obstetricians and Gynecologists. Now I think about it, more on that in a minute. We'll do this one thing at a time. Non-live vaccines have previously been shown to be safe in pregnancy. So flu, for example, whooping cough, and of course the COVID vaccine is not a live vaccine. There is no organism in it which is capable of reproducing, so it would come under this category of dead vaccines, and we have been giving those to women that are pregnant. Of course, this is a new vaccine, so it needs to be looked at separately. So that's one cause of sort of sporadic abortion. Recurrent abortions can be caused by quite a few different types of genetic abnormalities, chromosomal abnormalities, gene abnormalities. There can be immunological abnormalities, trauma to the mother, uterine abnormalities, such as even large fibroids or something like that. But most often the cause is not known. I'm afraid this just happens, sadly. Remarkably distressing, of course, for all concerned. Risk factors for spontaneous abortion: increasing maternal age. So over the age of 35, the risk is greater. And I've left these hyperlinks in the description. History of spontaneous abortion is one factor. Cigarette smoking is another factor. That badly affects the placenta, of course. Use of certain drugs, not really surprising. Cocaine, alcohol, high doses of caffeine. Not a lot of people might realise that one, so that one's well worth knowing about. And a poorly controlled chronic disorder, as we looked at yesterday. These can be major problems. So people with ongoing poorly controlled diabetes, high blood pressure, thyroid disorder, or other long-term conditions. So that brings us on to looking now at the first paper that we want to look at, which is this one here: spontaneous abortion following vaccination during pregnancy. This paper's from the 8th of September. Great to see that these are still free. There's the paper there. You can download the PDF, check on what I'm saying. Don't take my word for things. Always check on whatever you can. All I can do is give you my best interpretation of the papers. So spontaneous abortion following COVID-19 vaccination during pregnancy, 8th of September. So they make this point: concerns regarding risk of spontaneous abortion may be a barrier to vaccination during pregnancy. Well, that is certainly true, isn't it? If people think there's a risk of this, that's going to discourage vaccination during pregnancy. This paper, the authors say, Journal of the American Medical Association, it's a JAMA paper, peer-reviewed, of course. We present findings from case-controlled surveillance of COVID-19 vaccinations during pregnancy and spontaneous abortion. So here we have some degree of case control rather than just population studies. So the CDC tends to do just a lot of population studies. Here they're trying to do a bit of a case control study, which of course is better. They took data from 8 health systems in the States there, and they did what they call 4-week surveillance periods from 15th of December 2020 through to June 28th, 2021. So quite a good chunk of data there. Ongoing pregnancies between 6th and the 19th week. So here they're looking at abortion as opposed to miscarriage. Now, this paper doesn't say anything about miscarriage because that's not what it's about. It can only say what the paper is talking about. So this is up to 20 weeks gestation. So already we're kind of getting a bit confused after yesterday because we're talking about one thing then the other, but this is just the information that we have. Results of the 105,446 pregnancies. There was a lot. I think that's a lot. 13,160 spontaneous abortions. 92,286 ongoing pregnancies were identified. So quite a high proportion of spontaneous abortions. This is more common than people often think. Vaccines during pregnancy and before 20 weeks of gestation. Now in this study, 7.8% of people had a Pfizer, 6% had a Moderna, and 0.5% had a Janssen Johnson & Johnson. Now, the numbers in the Janssen Johnson & Johnson weren't high enough, so they couldn't do any stats on that. So this is actually based on these two. This is where the information is, not on the Janssen Johnson & Johnson, just not enough numbers. So a COVID vaccine was received within 28 days, within 28 days prior to an index date. So they're sort of looking back over the month. and 8% of ongoing pregnancy periods and 8.6% of spontaneous abortion. So we see slightly more miscarriages occurred, 8.6% versus 8% in the spontaneous abortion group. Slightly more had a vaccine, but they do say spontaneous abortions did not have an increased odds of exposure to a COVID-19 vaccine in the prior 28 days compared to ongoing pregnancies. So although that difference was there, it wasn't significant. And when they looked at the whole numbers, the adjusted odds ratio were 1.02, which is not, that they believed was not significant. So you could be pedantic and say, well, that means a 2% increase in spontaneous abortion, but they don't do that. They say it's not significant. So this paper concludes results were consistent for mRNA and the Pfizer and Moderna vaccine by gestational age group. In other words, as we know, older mums are more likely to have spontaneous abortion, and the results were consistent with that. And their conclusion in the discussion, despite limitations, these data can be used to inform vaccine recommendations and to counsel patients. Well, okay, that's what they're saying, but a fairly bold claim, really. They're saying that we can basically take this from the paper into clinical advice. Well, it is quite large numbers, and that's what this paper is saying. And it's a peer-reviewed paper, and there's a lot of contributors, and that's what they're saying. So don't get at me. I'm just reporting what the paper's saying. They're saying you can use this to inform recommendations and counselling. Now, the next paper I want to look at is this one. I think this was the one that was a little bit less clear. Receipt of a mRNA COVID vaccine and the risk of spontaneous abortion. And this one is New England Journal of Medicine. So these were looking at singleton pregnancies, so not twins in other words. 2,456. So again, reasonable number to look at. And they were taking data from here, the VSafe, from the Centers for Disease Control, VSafe COVID-19 vaccination in pregnancy site. But anyway, let's get on and look at what it's about. So information taken from there. Patients who were mothers who had received at least one dose of an mRNA COVID vaccine, either before conception or before 20 weeks of gestation. And nearly all of them was Pfizer, so 52.7% had the Pfizer vaccine. So here we have quite a large group had had the vaccine to compare it to. Cumulative risk of spontaneous abortion from 6 to less than 20 weeks of gestation was 14.1% altogether. So quite high, 14.1%. But this is about normal apparently. Cumulative risk of spontaneous abortion increased with maternal age, of course. Now, this paper was a bit difficult to understand, to be quite honest. It's not the best written paper I've ever read. And what they actually talked about was contact. Now, by contact, I assume they mean contact with a vaccine. But cumulative risk of spontaneous abortion for 6 to 20 weeks of gestation went up to 18.8%. Now, they did say this was the maximum, based on missing data and everything. So it does appear that the risk of spontaneous abortion there is higher, 14.1 there, up to 18.8 there. But this was the most pessimistic that they could possibly make it to be as safe as possible. So they believe, they don't actually say this, but they're implying that they believe the actual rate was quite a bit less than that. But they say, this is a direct quote, our findings suggest that the risk of spontaneous abortion after mRNA COVID-19 vaccination, either before conception or during pregnancy, is consistent with the expected risk of spontaneous abortion. In other words, it doesn't increase according to their conclusion. Now, that doesn't quite make sense by their figure, but that is their conclusion. But they do say that's the worst possible sort of scenario type figure. And they conclude these findings add to the accumulating evidence about the safety of mRNA COVID-19 vaccines in pregnancy. So again, the conclusion is fairly consistent even though the data there is slightly more confusing. And I personally found that a fairly difficult paper to understand, but that's what they're saying. They're reaching the same conclusions. And again, this is not just any old journal. This is New England Journal of Medicine. It's got a lot of information there. It's got very reputable group of people here who are taking part in the study and writing the study. So that's what they are saying, or that's my understanding of what they are saying. Now, next one, this is an adjustment. This one's a bit of an adjustment, which is quite interesting. So it seems this group underreported things, that the risk was less, and then they increased the risk slightly when they reanalyzed the data. Let me tell you what they seem to be saying. Now, this was another group of CDC researchers. And again, 6 weeks to 20 weeks of gestation. And after adjusting, they say the estimated risk, 14.1% overall, 12.8% in age-adjusted analysis, because we know that older women are more likely to have spontaneous abortions anyway, unfortunately, are consistent with the risk of spontaneous abortion reported in the general population. So again, they're saying that the risk of spontaneous abortion is the same as in the general population. Now, what I'd like to do now is tell you about the risks from 20 weeks to 40 weeks in pregnancy, but the papers aren't there on that. So the paper we looked at yesterday was mothers actually into women actually in getting delivered who tested positive for COVID at the time. The papers that we have are largely, in the peer-reviewed literature that I could find, were largely on the early stages of pregnancy. So it looks like we're missing data on the later stages of pregnancy. But what I want to look at in conclusion is this. Now, this is what we would go from in the UK. Now, this is from the Royal College of Obstetricians and Gynecologists. So this is like the most prestigious grouping for this in the UK. And let's have a look at some of the things that they are saying. Presumably they have access to a lot more data than we have. A very thorough report here. It's all there. It's all public domain material. I'm just going down here because I'm just wondering if they've got a lot of references, because they've probably been able to find some things No, they don't actually. They don't have a large reference section there at all. So this is more their sort of a cumulated opinion. And this, of course, is very much part of evidence-based practice. In evidence-based practice, we talk about three criteria for evidence-based practice. The first is the research that we've looked at. But unfortunately, we don't seem to have a lot of research on the risk of miscarriage from 20 to 40 weeks in pregnancy. Although those papers are saying that there's essentially no increased risk from week 6 to week 20 of pregnancy. So the first thing is the research. The next part of evidence-based practice is consensus, expert-based opinion. So this happens quite a lot. I mean, most medical specialisms in the world, they'll get together and they'll have a conference or something, and there'll be an expert group. And where the research is not clear, they'll come to a consensus, and there'll be consensus guidelines. And that basically is the nearest we have to truth until the research is actually fully carried out, the consensus of experts. So this is kind of the level this is on, really. But it is the Royal College of Obstetricians and Gynecologists, so not for me to argue with them. COVID vaccines are recommended in pregnancy. They clearly state vaccination is the best way to protect against the known risk of COVID-19 in pregnancy, both for women and babies. And again, these are all clearly there in their release there. Including admission of the women to intensive care and premature birth of the baby. So again, the same protects against that. We don't want any of those things, of course. They say you should not stop breastfeeding in order to be vaccinated against COVID-19. So carry on breastfeeding is what they're saying if you are breastfeeding. Women trying to become pregnant do not need to avoid pregnancy after vaccination. and there is no evidence to suggest that COVID-19 vaccines will affect fertility. Now, this is one of the common sort of disinformations that's talked about, that the vaccination causes loss of fertility. Now, whether it does or not, I don't know. The years haven't passed yet, but the Royal College of Obstetricians and Gynecologists is stating that it doesn't. And that they're the experts, so I report what the experts are saying. This is the best we have in terms of UK data at the moment. So far, actually, this website was actually updated last on the 11th of October. So it's not bang up to date, but it's 11th of October is pretty good. It's only the 22nd of November now. I expect they'll update it again soon. But as of the 11th of October, more than 82,000 pregnant women in England have received at least one dose of COVID-19 vaccination, and Public Health Scotland, and again I've left in the hyperlinks in the description, have reported that more than 19,000 pregnant women have received a vaccine. So 82,000 in England, plus 19,000 in Scotland, and no serious adverse effects have been recorded, according to the Royal College of Obstetricians and Gynecologists. Now, I think we can assume these people aren't blatantly lying to us. This is their current understanding, so that this is the best knowledge we have at the moment. No serious adverse effects recorded. They also say research from across 6 studies in 4 countries involving more than 40,000 pregnant women showed that having the vaccine does not increase the risk of miscarriage. So having the vaccine does not increase the risk of miscarriage, does not increase the risk of preterm birth, premature birth, does not increase the risk of stillbirth, nor does it increase the risk of small for gestation baby age. So fetal growth baby age is not affected. So here we are. This is them clearly saying that the vaccine does not increase the risk of miscarriage, preterm birth, stillbirth, nor does it increase the risk of a small for gestational age baby. But we did see yesterday, clearly from that CDC data, that COVID infection at the time of delivery does increase stillbirth, particularly with the Delta variant. Or the vaccination does not increase the risk of congenital abnormalities. So don't take my word for it. Now, this paper from the Royal College of Obstetricians and Gynecologists is completely comprehensible. It's remarkably well written, and it gives links to, for example, their robust real-world data from the United States, and you can just click and go to the site. It's hyperlinked. It's a very comprehensible piece of work, and it relates to other articles there. So even though it's not referenced at the end, there's references as we go through. And they seem happy to carry on recommending vaccinations in pregnancy. In fact, they strongly advocate for that. So that's the best information we have at the moment. If you like that, fine. If you don't like that, fine. That's the state of evidence at the moment as I understand it. And thank you for watching.